So because since we have limited time, so I think see these technicalities are part of the presentation. So being moderator, welcome to everyone for this session on or a panel discussion on width of homeopathy. And without taking much of the time, today we have with us the pioneers in homeopathy, the legendary homeopaths, even the teacher of teachers. We have Dr. SM Singh sir, we have Dr. Midul Kumar Sani sir, and Dr. A.K. Gupta sir. So if I am to take the cumulative experience of all these three panelists today, I think we have more than a century of homeopathic experience with us. So am I right, sir? Like
Dr.
you are there
Savan,
since
you are the
40
co-host.
years.
Dr. Savan, you are the co-host, please.
Yes, sir. Thank you, sir.
Now you can share. Now you can share, sir.
Thank you, sir.
And Dr. Tanesh, you can make Dr. A.K. Gupta and Dr. SM Singh also the co-host.
Yes, yes. Now I am the host, sir.
Yeah, so you make Dr. SM Singh and Dr. Dr. A.K. Gupta.
It's already done, sir. Yes, yes.
Yeah. So now, Saurabh will start the session now because he is the moderator for this session.
Yes, sir.
Thank you, sir. Thank you so much for this opportunity to discuss. And I always believe that there are something which we learn from each other. And today we have with us the pioneers, the legends, the living legends in homeopathy, whom we have since our childhood, we have grown seeing them in different areas of homeopathy, strengthening the homeopathy, representing homeopathy. From the clinical side, we have Dr. SM Singh sir, who is also from the education side. He ran the college for like decades. And Dr. Sani sir, and everyone knows Dr. Sani, and we don't need big introductions. Dr. Gupta sir, who is also a clinician and looking after the administration of the HMI, being the secretary general. So we have all these cumulative experiences. So today's topic, yes, the width of homeopathy. And I would take this as a moderator because we would like to learn from our panelist. What is the width of homeopathy and how we can reduce the gaps of homeopathy? There are two things because we all believe in philosophy. So width of homeopathy, yes, we have, and there are gaps. So without taking much of the time, I welcome Dr. SM Singh sir, Dr. Sani sir, and Dr. Gupta sir on the panel. And to ease out the discussion, because say it would be an interactive discussion. So to ease out, we would have views from clinical side, Dr. SM Singh sir, from research point of view, Dr. Sani sir, and from policy point of view, Dr. Gupta sir. So I have categorized the questions into simple, easy to follow questions. So our first concern or question is that homeopathy was founded on the principles of individualization. We all know the basic philosophy of homeopathy. But over decades, we have seen the complexity in the disease and presentation. So now this is the discussion point. I would like to first invite Dr. SM Singh sir, and would like to put one question to sir so that he answers that in the flow we are like planning to develop over this discussion. Do we have SM Singh sir?
Yeah, he is present. Dr. SM Singh, you can, yeah, he is present. Yeah. So you can ask, sir. He is open also.
Okay. So, sir, I would like to know how you find this challenging, this complexity challenging, and what are your views regarding the adaptability of homeopathy in complex condition over the years? So, because if I am to start, that the complex disease, the complexity of treatment, it is increasing day by day. So, what is your take? What are your views regarding this complexity in treatment also and diseases also?
Dr. SM Singh, sir, you can start.
Sir.
Yeah.
Sir, namaskar.
Good evening, sir. You start, sir. You speak, sir. Question has been put to you.
So I should be permitted to speak, should I?
Yeah. You have been asked to speak now.
Sir, we are talking about the most important subject, that is a doctrine of individualization. If homeopathy is being a science of the individualization, which is based strongly on the premise that two humans are not alike. That is the doctrine of the individualization. Once upon a time, a person had asked to a genius person, Mr. Newton, what are you saying upwards and saying God and God? And I will not go there. And he answered, Newton answered, my thumb is God. If my thumb is removed or it hurts, we cannot put my button, we cannot sew, we cannot apply the suture, we cannot hold the glass of water to drink water, we cannot count the pounds and dollars. Further, he replied that we cannot hold a pen to write down our research paper. Over and all, the impression of this thumb is not coinciding, not similar to others' thumb. So doctrine of individualization is the real science which has been blessed by Almighty, and a learned Dr. Burnett said that, and he emphasized, appreciated to Dr. Richard Hughes, that the individualization doctrine is the backbone of the homeopathy, and it differs from other system of discipline. And if we see the introduction of organ of medicine, fourth page probably, a minutest of individualization is not, if observed, then he is not a homeopath. Not only that, no rational healing art without strict individualization of each case of the disease for the purpose of treatment. Section 61 says that it is the only backbone of the homeopathy, and we differ from the other discipline of treatment. And that is why
Sir, I would like to know.
If we refer the pages of the Materia Medica, Suriname, where 5 pages has been described, and just above to relationship, strict individualization is only essential for the prescribing, making a prescription of Suriname. It is in Allen's keynote to realize the wonderful.
Sir, Dr. Saurabh want to say something.
Sir, basically we are having this panel discussion, so I would like to know your view over the time, like, because we are into individualization since beginning. So what are the challenges you have seen? Because the individualization with that passion we used to do 50 years back, is that passion still alive? And so what should we do to keep that passion alive for that individualization? Because nowadays we are prescribing on the name of disease only.
Yeah, we are accepting the challenges regarding the so complex diseases and so complicated diseases. And we are only, our prescription is entirely based on the homeopathic individualization. We do remember a commissioner of Mr. S.D. Bagla of Allahabad, who was operated by a head of department, Dr. Tehliani, and after 16 days, I was called, and he said only that do not touch my part, because even the touch of the cloth will be so painful. And the prescription was he herself. And 1 dose was given, and till today I am residing in the home that was given by Mr. Sondas Bagla. Individualization, though there was complicated cases and complex diseases are there. I do remember the principal secretary of health who was just coughing, and then that ceased in the sneezing. Boric said twice, Kent Repertory says twice, 15 medicines are there, but only single medicine is agaricus.
Very good.
If you are suffering with so many diseases, but one symptom which was indicating that each and every cough is spasmodic nature sees into sneeze, that is only agaricus. And my services in the government was extended by that principal secretary when agaricus was prescribed. So in the complicated cases, I have got 100 cases where we have to find out a correct prescription on the basis of the only we accept the challenges. We know so many cases of the hospital of Delhi also, and that was a very complicated case. A horse has hit his son, Mr. Babbar, senior advocate of Supreme Court, and he was unconscious, hospitalized in the Max Hospital. After 15 days, he was not in consciousness. I was called, and the photo was taken in that hospital. Only that arnica, the fourth line of Helensky note, that bad effects of mechanical injury, no matter how many years it was sustained, till today, 20 years has passed, and he was revived within 12 hours. So we are accepting the challenges. We have got so many cases, recorded cases, where the medicine board was medical college arranged, and they said that he's taking last breath. Patient was on the tracheotomy and artificial respiration. When I saw that in the hospital, feet was cold, breath was cold, coldness of perspiration, only prescribed a carbovasium single dose. Till today, 30 years has passed. The last stage of respiratory failure of the thickness is alive. So we are accepting, provided there would have been, physician must perceive where is the turning point, what is the obstacle. Section 265, if we know the art, how to remove the obstacle, we can provide the recovery. So among so many cases, we accept the challenges by the doctrine of individualization and section 165.
I will come to this part a bit later about the education part, what we are going to discuss, because see, we have to have this 45 minutes only, and to initiate the discussion. So I'll come to SM Singh sir part. Till now, the takeaway message is the individualization should be founded on the strong education and the power of observation. If we have a strong education and power of observation, the individualization is better, and this is how we can go to the complex disease treatment, right? So I'll come to Dr. Sani sir, because he has been heading the education for long. So Sani sir, what are your views, or how you would define academically the width of homeopathy, especially in relation to the clinical practice in complex diseases? So what is your view about this width and gap?
Thank you, Dr. Saurabh. Because this topic, I was pondering over it since long, and some long back, I had presented presentations on this topic also. So what I feel that in the present circumstances, academically, the width of homeopathy, it refers to the breadth, diversity, and adaptability of its principle, application, and scope across the clinical, philosophical, and research domain. It encompasses the multi-dimensional aspect of homeopathy, from individualized patient care, materia medica, and repertorization technique, to the integrations with the modern science, public health, and global well paradigm. Now, historically, the paradigm of homeopathy, which I had earlier presented also, was narrowly defined around the organ-based philosophy and symptom similarity principles, or like the similia musculosa. So now that this is a change, paradigm change is there. Now it is with the coming technology, coming scenario, and over the decades, so many changes has been adopted. Post-Hahnemannian Hahnemannian era. You can find that there was a contribution of Dr. Boniface, Kent, and other systematized mathematica, which had expanded that width of the Dr. Hahnemann. Then again, at 20th century onward, nosodes were developed. Nosodes, Sarcodes, isopathic arithmetic theory came up. In the modern era, we find clinical research is coming up, molecular understanding, public health integrations, and interdisciplinary relevance are coming up. Now, we are in the present era, we are finding that we are into the technology and the educations. During my tenure at the CCH, and right now, I see that the great advancement of the same concept of the technological understanding. So with the digital repertory, it has become so easy, AI-based case analysis, meta repertory analysis, then e-learning platform. So many aspects are there, which is making the, we have to think something widely about it. And with the global acceptance of the challenges, this is very important for the present situations. Database based around the evidence validations. Dr. Saurabh, we had a research gate, and I see a lot of papers are updated on that platform. And
Research is also part of this panel discussion.
Yeah.
Point we're going to come very soon. The research point of view from all the dignitaries. So
in essence, sir, I can tell you the width of homeopathy has grown from doctrine of individualization, individualized living, to a dynamic, interdisciplinary medical science, academically rich, clinically adaptive, and philosophical profound.
So, but what I can, learn from this point, that from individualization to interdisciplinary research, we are going a long way. So this width and obviously the gap we are going to discuss in few minutes. So this session, I would now, consult Dr. A.K. Gupta sir, and for his views that how do you look this complexity of the diseases from a public health and policy point of view over the time? Is it a width or a gap?
Well, it's something a very interesting part. When you talk of as a clinician, you have, as Dr. S.M. Singh has given such a wonderful examples and cases. We do not have got any dearth as far as the homeopathy is concerned for the form of efficacy and form of showing the result. But when it comes to talking about the policy matter and coming from at an individual level, you have got number of cases. But when we talk about at a cumulative effect on the forefront by some kind of a authority, by some kind of a public domain, there we are lacking the showcase. We are not able to bring forward the laurels of homeopathy, which we see day in, day out in everybody's clinic. Personally, all homeopathic doctors are doing wonderful cases, but when it comes to on a public domain, it lacks because of there certain reasons. We do not have that kind of a, means and for that kind of a publicity, or we do not have got any database on there where it can be seen that these are the things, these are the cases where homeopathy has shown very good results. Though we do have CCRH domain is there, but
Yes,
how far it has been going. But when we talk of the public, in a public manner, this should have been more pronounced, like by the way of newspapers, magazines, TV programs, radio programs, or awareness programs, which can be seen and be, made aware. The people are made aware about it, and then we see it would be the administration part becomes little difficult because you are not getting that kind of a data from any specific source. Dispensaries are there, which they are giving, you have number of patients, but time is very limited. That particular data, I am not very sure the data which is being shown, how far it is correct or how far it is. I'm sorry, but it's the thing comes it when we talk of in the quality of work and the quantity of work. There's a difference. Quality work can be done when you are doing as an individual clinic, but quantity work is being done when you are in the dispensaries. The number of patients are there. You got a limited hours to devote, and without having much of a case taking and all that. Again, if that particular thing comes with the observation of doctors, SM Singh sir, each and every patient, if they show, which also is not very often you come across. When you come in the dispensaries or hospitals, you have a routine cases like skin cases are there, you have got arthritis cases are there, you got a depression cases are there, or asthma cases are there, which have been prolonged for many years. And when they come, they come with an acute exacerbation of that treatment is given. So that particular data, which we need to combine and showcase in our public domain, this is where we have to work a little bit more. The private.
I'll come to that point a bit later, because see, that is also one of the discussion point, that because now from complexity, the understanding what Dr. SM Singh sir, I'm winding this discussion point one, because we have like 4 points in total and we need to justify the time also. So if I sum up this discussion point, that we need to be keen observer, we need to be that have observation should be documented in a framework. So
Yes.
if I'm right, if I can sum up that knowledge educational framework and presentation. So this will justify the presentation of complexity of diseases in today's scenario in homeopathy. Am I right?
Definitely, you are quite right.
Yes. So moving on to point 2 quickly, that now, because this point 2 is also important, and this is also what the challenge is. The homeopathic medical system is parted in 2 large divisions. Okay, one believes that homeopathy works, that like the clinical success stories, the clinical oriented homeopathy, we homeopaths, we believe, we don't have a suspicion. We are ardent followers of homeopathy. And then the other suspect its mode of action, its viability, research point of view, research in homeopathy. So what is your take? So I would again start, I'll go back to Dr. SM Singh sir. So what is your opinion regarding this clinical practice and research? Does this clinical practice add any value to the research, like considering your vast experience with the education, clinical practice and research?
Dr. SM Singh, you can.
Sir,
So,
please.
so I have a question to you. Considering the research in homeopathy, do you think that this clinical practice in homeopathy, does it add any value to the research?
Truly speaking, that the father of science, father of medicine, Hippocrates, discovered that the diseases are curable by 2 ways. One is by similar ways, and another is by dissimilar ways. By dissimilar ways was adapted by modern system, and by the diseases are curable by similar ways was left. That was our genius personality, Dr. Hahnemann, has found out. And so this similar ways system, they cannot be cured, they cannot be eradicated, they cannot be annihilated from its root. So our medicine are based on the similar ways, hence that selected medicine, Kantian philosophy says, only 2 components are essential for entire data and everything. Selected medicine must be capable to produce the identical symptoms of a disease, and it should be slightly higher than the existing disease, so that it should establish the section 26, the nature's law of therapeutics. A weak aerodynamic affection is permanently extinguished, and that is the entire homeopathy and nothing. And we can collect our data, so many things, where if we have perceived, a physician must be keen observer. If we are perceiving, where is a turning point? Where is a key point? From where the the patient has been deviated because the symptoms that has been section 99 health is when it is altered, when it is deviated from the healthy person, then that is the disease. So data is a anybody, every homeopath can do something better with on the similar symptoms only, on the law principles of homeopathy, on the finding out the PQRS section 165. Oh, Dr. Honeyman says, do you want to become a specific medicine doctor to collect the data for the research oriented? Come to me, I will let you know the specific remedy, not the medicine, not the drug. And Henneman said that is the only characteristic symptoms. Dr. Warning has listened it, peculiar, queer, rare, and strange. And he wrote a book on the comparative materia medica. And Dr. Gibson Muller, so he has written it on the symptom. Therefore, only characteristic symptoms, what Dr. R.P. Patel has taught me, if you know characteristic symptoms, even once upon a time, I had the opportunity to listen from Dr. Sahani sir also, from Dr. A.K. Gupta sir also, that if a particular characteristic symptoms, if we are getting it to individualize the case, then we should be able to give it details of homeopathic medicines and the single dose, single medicines are enough to establish the doctrine of law, our homeopathy system. Sir.
Thank you, sir. So, moving this thought forward, then I'll sum up this discussion point too. Moving this thought forward, Dr. Sani sir, I would like to know what is limiting this potential. What Dr. SM Singh has said that we have huge potential, and we know that. So, what is limiting this potential of clinical homeopathy from being adequately explored in research?
Yeah. So one of the important things that I find, the exploration of homeopathy in research is limited by a combination of scientific, institutional, educational, and perceptual barriers. These limitations can be broadly categorized into following different categories. One of the things is mathematic methodology. It is creating a great hurdle for the people to understand, and homeopathic individualized and qualitative, then standardized quantitative models like randomized controlled trials are required. Then placebo controls is also required. Then another factor is the lack of funding and infrastructure. This is very crucial because only CCRH is presently doing this work. So and the individuals, they don't find support, so they are not so much eager to undertake the research work. Then epistemological differences, the fundamental principles of homeopathy, vital principle, dynamizations, minimum dose, and individualizations are often dismissed by the misunderstood, by the domination side, not dominating scientific field. So this is very important, sir. Then inadequate research training. Now I can congratulate Dr. NCH that they have linked the education and research together, and every college must have the distance. So this technology has to be combined together. Then bias and prejudice. This Dr. Honeyman has itself talked about it, and scientific prejudice and lack of openness is very important to mainstream the homeopathic medicines. Then regulatory and policy challenges. There are we don't have still. I think there is a great requirements for a uniform regulation system. We have the fragmented policies also. So advanced structure, national research agendas is required, and then public misconceptions and media influence. This is very important aspects that we have to consider: public doubts and reduced participants, Nowadays, it is not so much like that, but still it is persisting, and we have to educate the people. We have to take the help of the media influences. So to overcome these limitations, we need a paradigm shift in integrating innovative research methodology, interdisciplinary collaborations, and a developing homeopathic specific research ecosystem. I think these things, if come into practice, we can have a more wider coverage among the publics.
Thank you, sir. So, in continuation, now a challenging question to Dr. Gupta, sir, that because he can answer it better. How do you look at research on complex disease in conjugation with the modern system of medicine? See, we have a challenge, and then we have a challenge of acceptance. Like Dr. Sani sir said that the bias, the Meison theory. So, if I talk of the modern system of medicine and the research on complex diseases, what is your take? Is there any conjugation? Is there any acceptance? If not, what are the challenges here in research from the modern system of medicine and complex homeopathy?
I think the very first and the foremost important thing about the homeopathy and research, which is very widely talked about, there no research is happening in homeopathy, and whatever is happening, it is happening in the given format of ICMR. I think the very basic fact of homeopathy, if we talk about the research, it has to be changed, because ICMR guidelines are different. They go in a one particular pattern of you take up a one particular drug and give on those patients. We do our random controlled trials or placebo trials, but until and unless, as per the basic principle of homeopathy, which is individualization, if the patient is of arsenic, all selected patient of arsenic and then given arsenic to them, then only we'll be able to get the correct effect of the homeopathy. But what are being done, if you have taken 100 patients of asthma and given arsenic to them, if they are not arsenic patient, they don't need an arsenic, they will never show any impact. If the patient needs bryonia, if the patient needs natrum salt, if the patient needs some other medication, so if we give arsenic, which will not give result. So the very structure of 100 patients may say, if we have only 5 or 10 patients of which were truly arsenic patients, they only will give us the result. Rest of the 90-95% patients will not give the result, and your research impact would be that this is not effective, which is the basic problem in homeopathic research. And if we start doing research from this point of view, first selecting the patient and then seeing the efficacy of the medication, I think then it will do altogether a scenario would be different. At present, we are following the modern medicine technique research methodology. You take one particular drug or one particular medicine, and you give to n number of patients and see the impact. In that, because those medications are chemical based and not individualized based, they are disease based medication. Whereas right from beginning we are talking about, when we talk of homeopathy, we are not talking in the form of a disease based treatment. We are talking an individual based treatment. And now it coming to your point of the complexity of diseases. There again, individualization of that patient, despite of having a complexity in the disease, is the hallmark, or it is the thumb rule which we have to follow. If we stick to those things, only then we'll be able to get the result of homeopathy, which can be shown in a much better manner. But if we follow the same kind of research methodology, which is not appropriate for homeopathy, like at present what we are doing, we are making a race of different animals. Like the research which is going, one is dog, the another is horse, another is camel, and one we are taking a bird, and to run into the on this road and see who comes first. If if the camel is given that kind of an environment where he is required to be, animals given the same kind of environment, only then they'll show their efficacy. At present, with this all given us one particular platform, all person from this side, person from that side, they can never have the same impact, and the result will never show the way we are going to hit who comes first. He is first in Registan, or he is first in the desert, but he cannot come first on the road and on the plain. The one who's been running on this fields, the one who is the water animal, he or cannot show that. So if we go with that, give that environment, give that facility or at same level for the homeopathy to talk, and then see the result, I'm sure the whole scenario will get changed.
No, surely we are going to change that scenario with that thinking with the like advancements in homeopathy. If I can sum up this discussion point, considering again the time, because the clock is ticking and we need to be on track. So if I am to sum up the point, what Dr. SM Singh has said, from the characteristic symptoms to adaptability to understanding the research. If I am to sum up these 3 points, we need the characteristic, the PQRS, the beauty of homeopathy. We need to adapt our framework, the technology from technology point of view, from research point of view, and we need to adapt research according to our own methodology, not the other way around. Right? So if let's move to the next point, then we can collate all the discussion point in the end. The third discussion point is very important from today's scenario. The integrative medicine. We all are talking about integrative medicine, this, that. And on the name of integrative medicine, we are mixing, combining, and doing n number of experiments we can't even think of. Just because we are the practitioner, we are practicing holistically, we are integrating medicine. So I would like to know your takes on this integrative medicine. So I would again go back to Dr. SM Singh, sir. Sir, do you feel that it is possible to develop homeopathy as an integrative medicine? And what a physician should be equipped with? If if we talk of the actual integrative medicine, what a physician should know, or how we should practice to follow that integrative medicine from the clinical point of view?
Dr. SM Singh?
This is a problem nowadays, that I'm now having experience of 54 years practice and aged more than 80 years. Nowadays, I'm seeing that homeopaths are in the shortcut prescription. And Dr. Herring has written a very small book, The Language of Diseases, the way of entering of a patient, the way of saying, way of sitting, way of talking, the posture, the way of behavior, everything patient he himself is telling, but physicians are not perceiving. A bank officer came to our clinic and having a handkerchief on the lips and so much swelling of the upper and lower lip. When he removed that cloth, he showed me so big swollen upper and lower. And he said, manager told me that I have taken APIS 10,000 also, starting from 6. Now the prescription was away from my hand. I thought then I should prescribe a true picture of the Apis mellifica. Then I thought that I should prescribe a placebo, and what should I do? And I will ask him tomorrow if he had consumed already Apis 10,000. Then I tried to inquire the language of diseases of the book written by C. Herring, that what you like? Do you prefer hot things or cold things? Do you prefer a short or sweet? Then he wept and said that I prefer only fish, I prefer only fish. And he started weeping. You can speak from your mouth. Why you are speaking from body language? I prefer, I do like, I am longing for fish. Since many months I am not consuming that. Then I refer a country desire, stomach, desire for fish. There was a netramure, italic letter. I gave you 201 dose. I have never seen in my practice shortest time, the entire swelling was disappeared. Then I phoned to Dr. S.K. Dubey to Calcutta. Sir, wonderful medicine. Then he told me, you do not know ABCD. Netramure is a complementary of Apis mellifica, only complementary, referred to book. So nowadays, our students, they are in a very short time to prescribe everything, not trying to find out where is a turning point, what are the relationships of medicine, what is the complementary, what is inimical, what is other things. So I believe and trust in my practice, what I have observed, that study the patient thoroughly by body language. Section 90, Hahnemann wrote only few lines, 3-4 lines, and footnote is near about 20 lines. Watch the patient, the posture of the patient, way of sitting, way of lying, way of talking, whether he is talking by hands, calibrometer, or whether he is constant dwelling of the lower extremity, this zincum metallicum, or upper extremity and lower extremity, both midrinum, how he is behaving, what is individualization, what is face continence, aconite, italic letter, see the continence of face, where is the fear, where is the anxiety, and after that, the holistic approach, that is differing from other system. That holistic approach guides our to find out the correct medicine, to remove our other light prescription, and to go over the chronic diseases. Because Hahnemann wrote in the section 80 footnote, indeed I spent my 12 years to find out what is the fundamental cause of the chronic diseases. And SORA, then I got, then syphilis and psychosis adults. And he has mentioned the complex diseases and chronic diseases, 56 name, including the cancer in section 80. So Hahnemann was a genius person. He told so many things, and he emphasized that the holistic approach, because Dr. Boyd, a father of textbook of pathology, writer of the textbook of pathology, the greatest mistake committed by physicians is that they are studying the patient in segregated form. A lady is not coming in our chamber by holding a lump of her breast in her hand. Doctor, Mr. Doctor, I have got a fibroadenoma in my breast. A child is not entering in our chamber by holding a lump of liver in his hand, that my liver is enlarged. Dr. Boyd is saying, pathology, father of pathology, he or she is entering in our chamber as a whole, study the patient as a whole, and that is the holistic approach of Hahnemann has emphasizes holistic approach. Then we will be able to find out the individualization. So homeopathy is a very difficult practice, but Kant says it's a very easy practice. He is saying only 2 components are essential to good homeopath. Your capable medicine should selected medicine may be capable to find out, to produce the identical symptom. And second component, it should be slightly higher. That is the simple way of homeopathy. Thank you, sir.
Thank you, sir. Thank you. So with this note, we are moving to Dr. Sani, sir, about his challenges to develop homeopathy as integrative medicine. I'll come to the holistic parts a bit like moments later after hearing Dr. Sani sir and Dr. Gupta sir. So, sir, Dr. Sani sir, what are the challenges as an educationist you saw to develop this integrative medicine in today's scenario?
Thank you, Dr. Saurabh. So today I was reading just an article, precision medicines. I think you might have heard about it, precision medicine. Nowadays, we are talking about the precision medicines and separate where the individualized based treatment is being practiced under this umbrella.
Yes,
when we see this under this aspect, if we can see our homeopathy, Dr. Henneman has long back talked about the this individualized system of the medicines. So integrations, because our national government is also very much anxious about implementing the integrated medicines by the 2030 or 35 or latest by that. So they are working on it. Our National Commission for Homeopathy is also working in it. But scientifically proving it is very important. So there must be a research of the interdisciplinary research, which is must go beyond the conventional clinical approach. It should involve collaborative efforts between the basic science, clinical medicines, data science, psychology, and public health philosophy. Then integrations with the basic science that needs nanotechnology and material science, then molecular biology and epigenetics and quantum physics. From the clinical medicines and public health side, we need comparative health effective research. These things we had been working in Patna about with the in coordinations with the allopathic physicians and the Ayurvedic physicians. And this comparative effectiveness is also very much required, so that we can say that where homeopathy is required, what is the limitations of homeopathy, what is the limitations of allopathy or the Ayurveda or itself. Then public health research is also required, health programs. Then the next point is the psychology and the neuroscience, which is mind-body research is very much important, because we as homeopathy, we consider both together, but other system of the medicine, many of the systems, they don't believe in the mind-body relative. So this precision medicines is also drawing like I think. Then data science and artificial intelligence, it is definitely it is going to revolve like the integrations we may have. But what Dr. S.M. Singh was talking, I quite agree with him that integrations, we must keep our system intact. We should not play with our principle. We should not dilute our principles of the fundamental principles of the homeopathy.
Thank you, sir. So you have actually simplified because these were the points I was about to take into the final statement. So before that, let's hear next 2 minutes, then we can wind this on time from Dr. Gupta sir. Sir, you have been pioneering and establishing a setup in integrative care long back, your OVHums. And so I would like to know what were the ground challenges, whether there's the challenges is acceptability even. So we talk of integrative medicine, we talk of characteristic medicine, we talk of frameworks. Ultimately, it is applied to the patient. So what were the ground challenges and acceptability issues of this integrative medicine in today's scenario?
Well, first of all, when we talk of the integration...
Just a moment, Dr. Gupta. May I request Dr. Manoj and Dr. Dhanesh to kindly extend this time of this meeting for another 5 to 10 minutes. Will it be possible? So that one more point is left. If it is possible, then we can proceed. So you can continue with Dr. Gupta.
Yeah. As for which, you talked about it, OVMs. We got the idea of every system has got something to offer, and every system has got limitations. If we understand the efficacy of each system and the limitations of each system, I think then we can really do wonders and betterment for the patients. There are cases where the patients who have been on prolonged medication for some heart problem or some chronic renal disease or some other problem, and they have been taking medicine for years together, and then they have some other problem and they come to a homeopathic doctor, but they fear, like, sometimes that if we take this medicine, we'll have to stop this medicine. Or rather, few of the, our colleagues have been saying them to stop their medicine because when you take homeopathic, no other medicine should be given. So this is a very big challenge and a big particular problem. Without understanding the patient's need, we just stick for this, like we are giving homeopathy, so no other medicine. I think this will be counterproductive for the patient, and it can be very dangerous and causing a problem. So what we need to do is we need to take care for what particular problem he has come to us. Of course, keeping all principles of homeopathy along with that, but not asking him to stop the medication there and then. With that, the patient who has been dependent on those medications, his immunity is already would be compromised, and he might get into a more complicated problem. And the thing would be said that you have taken a homeopathy, that is why it has happened. But we see patients when we go to some ICU cases also, there also, despite of having all the paraphernalia given by that hospital and this nursing home, homeopathic medicine given on those particular symptoms which we have observed as an individualized has done wonders. Those who've been taking anti-diabetic drugs for years together, and there's a time when it has stopped working, whether it is for hypertension. If we have given homeopathic medicine as a constitutional medicine, it has revived the efficacy of that particular patient to restart with those effect on that medication. So that is the beauty if we integrate the kind of a, as we say, that stimulation which the patient has been missing, which can be given by homeopathic medicine by the proving of what you call simillimum. If it stimulates his vitality to overcome the problems which he has been finding with those allopathic medicines, like for chemotherapy or even radiotherapy, the patients have been going without taking any medicine. They find it that they are not able to cope up. And once homeopathic medicines have been given along with them, so they have been able to sustain the, those treatment, which was not possible for them to do it. So in a way, it works as with the integration. You can work as a complementing to the patient, and directly, if you're not helped the patient in a cancer, but you have definitely helped the patient to complete his treatment, whatever he was undergoing. So this kind of a approach was, the thing. And the challenges, what, you asked me what challenge we felt. Initially was like since mine was a private, setup, so everyone was interested in his, share. Suppose if I send my patient to the different branch and different, so I'll be losing my patient. So whereas I am sure if you have given a right direction to your patient at the right time, he will never go anywhere. And the efficacy of your referral at the right time, because there is a very thin line, we must know where to, ask for a patient to go for an operation and where not to go on for operation. These kind of integration is required.
I would take a pause here because we need to conclude this session on time. So,
Dr. Saurabh,
yes,
I have requested the organizer, but they said it will not be possible. So we can have the second session, second part of this discussions later on.
Sure.
Will it be possible, sir, Dr. Saurabh?
I think we can conclude this because just got a message that we need to conclude on time. So anyways, see, these are the part of ongoing things we have been talking for years together. So I'll sum up this discussion point in 3 points: that homeopathy, to be an integrative medicine, it should be a holistic, it should be precisive, and it should be logical. If I'm to sum up this session, that holistic, logical, and precision medicines made together, they make as homeopathy as integrative medicine. So I was to take the discussion part 4, but most of the point in discussion part 4, I'll show you on the screen, they have been taken care by this discussion we are having. So I would request each of the panelists to take 1 minute to conclude their thought about the width of homeopathy so that we can conclude this session on time. So I'll start with Dr. SM Singh sir, just his takeaway message in 1 minute about the width of homeopathy.
Dr. SM Singh?
1 minute for what, sir?
Sir, your takeaway message for homeopaths.
Thank you very much, sir. Such a nice organization. And I'm thankful to convener who is putting such a difficult questions. And everything is okay. Nothing. These are encouraging us. These are promoting us. And the eye-opener session. Nothing to say more than.
Thank you, sir. Thank you so much. Dr. Sani, sir, your takeaway message.
Yeah. So my point of view is that research bricks should be gapped by translating the classical concept into the measurable outcomes, using mixed method studies, then align rubrics with the modern diagnostic and adopting digital tools. By doing so, we can preserve homeopathy's soul while meeting the today's clinical demands for evidence, precision, and replicability.
Thank you, sir.
Yeah.
And now to Dr. Gupta, sir. Sir, in 1 minute, what is your takeaway message for width of homeopathy?
The width of homeopathy has no limit. I think that is the one thing which we must understand and which everybody should realize. If given it in a right perspective, right manner, and with the, we have all the, patronage and the backing from the government, from the other, in a public domain, I think homeopathy will put many things in a much better manner. And with this, we say that we can, with the integration also, and as an individual system of medicine, it is, one thing which has been very, very effective. People should take out their myths, and for which we need, more and more awareness kind of a program like this for the people and for the doctors also. Thank you very much.
Thank you, sir. With this, although again the clock is ticking and we need to wind up our time, I personally believe that this discussion, this panel discussion, can go on, or maybe next time we would have more time to discuss such things which open up frontiers, avenues for discussion in homeopathy. So with this, a very warm, a very big thank you to all of the panelists, Dr. SM Singh sir, Dr. Sani sir, and Dr. Gupta sir, for their valuable time and for their valuable knowledge. And now I can say that we have the century of cumulative knowledge today in front of us regarding the width and gap of homeopathy. Thank you.